Physical exercise is essential in order to maintain optimal motor functions and general physical health. Regular exercise and movement not only strengthen the immune system and prevent numerous diseases, but also improve fitness and general well-being. But what if physical limitations make it difficult for someone to move independently? How can activity and flexibility still be maintained? Lack of movement can cause a number of health problems. These can range from joint stiffness, loss of muscle mass, circulatory disorders and muscular stiffness, through to painful spasticity, high blood pressure, and impaired cardiovascular performance. Today we're visiting the headquarters of the Schmiede clinics in Allensbach near Lake Constance in Germany. The hospital was founded in 1950 by Professor Friedrich Schmiede. Since then it has established an excellent reputation as a specialist centre for neurological disorders and as a pioneer in the field of neurological rehabilitation in Europe. Each year, about 11,000 patients with various neurological diseases of differing degrees of severity undergo rehabilitation at the Schmiede clinics. The hospital has its own institutes for scientific research and teaching and provides a continuously high level of expertise. The holistic treatment concept takes account of the medical, social and vocational rehabilitation and training of patients suffering from brain injury complications. Complex brain disorders often require the expertise of several therapists from various specialist areas simultaneously. For many years, the doctors and therapists have been successfully using the MOTOmed movement therapy devices made by the REC company as an additional supporting therapy option.
At the Schmiede clinics, we treat neurological patients at all severity levels. This means that we have a Phase B, including early rehabilitation, followed by Phase C and D. Patients include stroke, traumatic brain injuries, Parkinson's disease, and patients with inflammations of the nervous system. Patients are treated here as well as at other various locations in Baden-Württemberg. For more than 20 years, the Schmiede clinics have been collecting experiences with the MOTOmed devices in seated as well as supine position. At this location, we are utilizing 22 MOTOmed devices. We have more than 50 devices in use in our 6 locations. We are using all 3 MOTOmed training modes: the passive, the motor-assisted and active-resisted mode, depending on the individual needs of different patients. Goals are to reduce spasticity by preventing joint stiffness and trying to increase muscle strength, and therefore indirectly optimizing walking ability. Our patients usually start with a passive warm-up phase, meaning the MOTOmed is moving the pedals for them. The MOTOmed cycling motion increases the blood circulation, helps to maintain physical functions, and has a direct influence on improving muscle tone. As soon as a patient's condition improves, they can increase their own activity and reduce the passive training time.